Hi, my name is Carley Cook. I am a registered medical assistant through American Medical Technologists, and I have been a medical assistant since January of 2017. I wanted to take this time in this video to kind of tell you my story and tell you how I got to where I am today. Because believe it or not, my whole childhood, every time somebody asked me what I wanted to do when I grew up, I had a couple things that I wanted to do, but I would always add anything but healthcare. So, finding myself working in healthcare as a medical assistant was kind of shocking at first to me. Just because it was something that I had told myself that I never wanted to do. But to begin the story, we have to go back quite a ways. I was born with a genetic connective tissue disorder called Ehlers-Danlos Syndrome. Ehlers-Danlos Syndrome affects the collagen in the body. It makes the collagen weak or defective. Because of that, it creates very frequent dislocations, subluxations, pain, insomnia, fatigue, you name it, brain fog. It's all included. And I started showing symptoms of this when I was 2 years old. I dislocated my elbow 12 times within a year. Then I started complaining about back pain when I was 4. And believe it or not, every single doctor and specialist that my mom and dad took me to all brushed it off and said, oh, it's normal. It's just growing pains. Don't worry about it. Which obviously was not the case. And I wasn't diagnosed correctly until I was 23 years old. So I spent 21 years of my life thinking that I was normal, and so therefore I would push myself to try to accomplish things that other people that were healthy and normal could do, which in turn caused permanent damage to my body. And I truly believe that if I would have had somebody in the office at any of those offices who was an advocate, somebody who could go to the doctor and say, hey, something doesn't seem right. I think we should look into this more. I really feel like my life would be different. I feel like I wouldn't have as many problems as I do now. And I'm 29. So, because of all that and not being diagnosed until I was 23, I had obviously seen the bad and the good of healthcare, but a lot of bad. And it bothered me that other people were having to experience the same thing. And so that kind of forced me to make the decision, but it guided me towards actually wanting to go into healthcare, because I really wanted to be that advocate. I wanted to be that person that my patients could say, I know there's someone in the office that cares about me as a person and not just their paycheck. That's really important to me. It's my passion, it's my purpose, I feel. And unfortunately, even though patients love that, management and administration usually doesn't, because that sometimes means spending extra time with a patient instead of just getting people in and out. So because of that, I've struggled a little bit throughout my career, because I had the thought of, the attitude of, if it slows clinic down, it slows clinic down. But I have somebody sitting in front of me bawling their eyes out. I'm going to sit with them for a minute. So it was really important to me to do that. And so I honestly, I've been an MA since 2017, and I just now, 2 months ago, found my office home. Found an office where management, the surgeon I work directly for, and coworkers of mine, I feel so appreciated and so valued, and it's amazing. And so I guess part of my story that if you don't take anything away from this story except for one thing, I want you to know that if you're struggling to find your office home, keep going, because eventually you will find it. But you gotta also look at, what are you passionate about? And what's the difference between working in family practice versus a specialty for you? For me, I have no desire to work in family med. I like my specialties. I like my surgery offices. I like being able to learn a lot of information on a couple things rather than a little bit of information for everything. So if you're like that, then working in family medicine is probably not a good choice for you. And so being able to kind of look at yourself and see what you are interested in and what you like to do is super important in trying to find your home, your office home, your work home. So I guess my current position, so 8 months ago or so, I had started this new job and was super excited about it. Went to EHR training, and because of COVID, there was me and 2 other people there, and that was it. One of which was a department administrator in orthopedic surgery. And because of my health issues, I know at some point I will need an orthopedic surgeon. So I figured it would be nice to have his phone number so that way I can contact someone directly if I ever need it. So we exchanged contact information and then didn't really talk for about 5 months or so. And then all of a sudden I get a text message out of the blue saying, "Hey Carley, we just created a brand new position and I think you'd be perfect." And by the way, this position you are going to literally be the right-hand person for one of the best, if not the best, orthopedic surgeons in the country. He's so well known and well respected. He has people from all over the world, trying to call to schedule appointments to see him. And so he's really important. He's a really big deal. And so of course I was nervous, but I was also super excited. And this position involves things like writing legal narrative reports, so summarizing every office visit for patients that were involved in a car accident or personal injury, writing letters to attorneys, creating the orthopedic monthly newsletter that also comes with continuing ed questions and credits for physicians. And we create this newsletter and print out 500 copies of it and then distribute it to doctors all over the area. There's so many things, there's so many projects and big things and little things and that this position entails. However, this is the first time that I've been in an office where I feel like my supervisors and the people that I work for respect me and appreciate me and value my opinion, and I'm important to them, and I'm not used to that. So I guess the point is if you haven't found your home yet, keep looking, because eventually you'll find it, whether it's, in a month or in 4 years. But every experience that you have along the way is going to help prepare you for whatever that position ends up being in the end. And so, that's something super important that I wanted to mention. And honestly, I am an incredibly proud RMA. I am incredibly proud that my credentialing agency is AMT. And that's because I feel like they are more understanding, and just the culture and the vibes, I guess you could say, are happy. They're positive experiences. I haven't had a negative experience yet with AMT. And, so I'm super, super grateful for that. Another thing too is keep in mind that medical assistants do a lot of different things. And I know you all know that. And like, for example, my position isn't typically for a medical assistant, but because I'm a medical assistant, it made me a lot more marketable. It helped me a lot with, being hired for this position. So, I've learned over the years a couple different things that's important. And I will tell you a secret. My mom, way back when I first started working in healthcare, my mom told me this piece of advice that I honestly believe has been incredibly important when it comes to my career. And what she told me was to always treat the doctors as though they are the most important person in the room, other than patients, and over the years, I think have had more respect from my surgeons because they know that I am like that. And so, kind of making them feel like they're the most important person in the room. The other thing I found that sometimes I think has helped is I created an online portfolio, something that normally like a photographer would do. However, mine it has my resume, it has, I asked different coworkers and physicians I've worked for and, different people, and I've also asked patients, like what separates me from everybody else. And I have a page on my profile that explains that and has a list. And then I also have other information about me. I have an introduction. And what's really kind of neat is I include that on my resume after my email. So that way, if somebody, if the hiring manager where I'm applying to is curious for more information or wants to learn more about me without, asking me, they can go right to that and they can learn a lot about me from there too, which is I think it's kind of cool. So those are kind of 2 tips that I've found over the years that makes a difference. So anyway, I hope that sharing my story, and I hope that my story has been able to bless or been a positive thing for you. I know my story can be a lot. But I just wanted to end this with saying thank you to a couple people. So I have to thank my parents, because without them I would not be the person I am today. They have supported me every step of the way as much as they possibly could, and I really don't think that I could have had better parents. I also want to thank my new supervisor, who's the person that I met during EHR training, and the surgeon that I work directly for giving me the opportunity to stretch my comfort zone and try something a little different, and to trust me and respect me and appreciate me, because I don't think that either of them totally realize how much they've changed my life. I also want to say thank you to each of you. Everybody that works in healthcare, especially us medical assistants, because I feel like sometimes we get forgotten. But I know that the last year and a half has been a big struggle for us. Like I was saying earlier, I've experienced burnout a couple times throughout my career, and 2 of those times were during COVID. So I wanted to just say thank you for all of your sacrifices and for putting the patient first and working so tirelessly, especially since I know a lot of times we didn't get the thank you that we deserved. So I just wanted to end with that, and I hope that you enjoyed learning a little bit more about me. Thank you, and take care.